This is Harold H.B. Bell, and we are bringing you the Spectrum live from Autism Parent Care. Dr. Jane Yip and myself are going to be discussing a very, very familiar topic today, but one that is foreign when we're talking about autism spectrum disorder. Dr. Jane Yip said today we're going to talk about love.
We're going to talk about love. We're going to talk about unconditional love, and especially unconditional love between parent and child. It's a beautiful thing, and it's also can be a problem. And we're going to talk about what unconditional love is and isn't.
Well, let's talk about love. I guess first and foremost, we know, on the surface, love is an emotional attachment to another person or another object or a pet or whatever. But the truth of the matter, when we're talking about love and dealing with autism spectrum disorder, many of the parents have taken love and kind of put it on steroids for a lot of the things that they can't control, maybe some of the things that they don't understand. Maybe some guilt is built in there from bringing this little loved one into the world who has some disorders. So let's talk about love and the layers and levels of what we're talking about when we say unconditional love.
Unconditional love, at least in my books, right? Everyone has their own definition. The way I see it is you accept the other party the way they are, warts and all, and you don't try to change them, and you basically, do something that is helpful to them, right? You want to promote their well-being. That's my vision of unconditional love.
Jane, when we're talking about this, and the reason we're diving into this is we were having candid conversations over the last month about the love that the parents are giving their children, and sometimes love turns to poison because of the unconditional side of it. And you just mentioned something very interesting. When we see people with warts, if we see someone who might have both legs amputated, if we see someone with a physical problem, I think it's easier for us to get over the guilt factor and say, okay, how can I love this person just as they are? One of the things about autism that I notice is that you can't look at that problem, see that problem, so you're always, I think, in the mystery of, can this person get right? Can I make this person better? And most times parents try to use love to be the bridge instead of the therapy that you're prescribing to help work with these children.
I agree 100%. So, and this is not all parents, and this is very understandable and normal. You don't expect to have a child that is on the autism spectrum or who have any issues with the mind, because anything that happens in the mind, nobody can tell, especially when the child is high functioning. It's even harder to tell. So when problems comes, right, and because want to make it better, you tend to, instead of helping them, enable them, because you don't want to make things uncomfortable for either the kid or for yourself. You want to keep peace. So whatever it is, look, if Johnny is throwing a tantrum in the middle of the store, you don't want to create a scene, you just give him the candy. So those are some of the problems that I see, which is you don't want to rock the boat, so you allow the kid to do whatever they want. And that then becomes the problem, and that is what I call an enabling relationship, because certain behaviors that are not socially acceptable, you name it, anything, disruptive behaviors, in public, hurtful behaviors, verbally can be problematic. So in a neurotypical child, the parent will not think twice to say, stop doing that. No, that was not polite. I want you to say it again. In a normal kid, parents have no problem saying that. But in a kid which they see as, a weaker person, somebody who needs help, they would give the kid the benefit of the doubt and will say, okay, he or she has autism. It's okay, I'll just let him off the hook this time. That sort of thing.
And that is where I think the guilt comes in. When we were talking about this earlier, because of, I know my child has a neurological disorder, let me just bypass some of the disciplines that we would normally teach our quote unquote normal children. And it's quite the opposite. Really, it should be the opposite. We should be working on those things that we know are the dysfunction of that child, and pinpoint that and work on it as much as we can, instead of ignoring it and letting that child, as you mentioned, when I came in on the previous broadcast, the negative reinforcer will be positive to that child's behavior a lot of times.
Well, the thing is, you would you would not expect your neurotypical child to, let's say you visit somebody and they will go into all the things, right? Or you are invited to dinner and your kid grab everything on the table. For a neurotypical child, that is very embarrassing, and certainly you will say, stop that. But if that kid is on the spectrum, you make excuses. Grandparents make excuses. And
aunties make excuses. Everybody make excuses.
Yes, he's just messier or whatever. We'll clean up after him. That is what I mean by enabling.
Yes.
And if it keeps continuing, the kid thinks that he can do whatever he or she wants.
And let's talk about the blessing and the curse, because you were talking about high-functioning individuals on the spectrum, and there's some, when as soon as you look at them, you know that there is an issue, some type of brain disorder. But when we see these children who are high-functioning, if you were just to sit at a table, you would not be able to tell that they had an issue that was disconnecting their everyday functioning skills. And so those, I call it the curse, because you don't know, and so a lot of times people are expecting normal behavior, normal tendencies out of children, and you just won't get it. But you can sit there and talk to them, and I think it's a curse for the parents as well when we start talking about that love, that unconditional love, because for some reason they're waiting to wake up one day and my child's gonna be normal because they get some normal activity. but the truth of the matter is, we have to work on this every day, like a habit, to make some of these children better who are high functioning, so they can stay out of harm's way and be productive in the community as well.
So I actually really like the point about they have it in the back of their mind that one day they wake up and this kid will be normal.
Yeah.
And everything will be back to the way they have idealized in the beginning. So what happened is they made some gains in therapy, and then all of a sudden they want to back off everything. It's like if you have diabetes, right? You take your diabetes medicine, and then of course it's going to make you feel better because it balances your blood sugar and you think I'm cured. So you stop taking your medicine. Guess what happens? Same thing here. They do something, they have some gains in therapy, and all of a sudden they say, well, my kid is cured, thank you very much. And then this kid can be back into, I call it back to the wild. And that's when things come crashing down. And I know it's difficult to confront the reality. A child that's on the spectrum will always be on the spectrum, no matter how normal the behavior is. And I do get it. There are some kids that has learned so well that the way they behave, the way they see things are indistinguishable from a normal person. And those cases has happened and do happen. I am not saying they don't exist, they do exist. But in most cases, your kid needs a lot of help. Agree with that? But your kid is also a human being, which should be required to follow certain social rules.
And I guess if we were just to summarize this segment on love and how parents can really show true love, I would just say this as a therapist: trusting the prescriptions and the prescribed diagnosis that you have, and the treatment procedures that we will apply to these children. If you really love your child, you're going to have to trust.
You're going to have
to trust Dr. Yip, you're going to have to trust your therapist, and then you're going to have to, more importantly, I think, trust yourself, because you're going to have to take some of these tools home and try them, and it might not be what you're used to. It might not be the loving, kind, flowery day that you want to have with your child. This is discipline.
Well, it's not lovey-dovey, it is tough love. So unconditional love doesn't mean, they can do whatever they want to unconditionally. That's not what it means. Unconditional love means doing what it takes to give them the best chance in life, and sometimes it may not look kind per se, it may not look gentle, and sometimes it looks downright harsh.
Yeah. And some of the measures that we have to use and take are harsh because we're trying to stop habits. We're trying to stop uncontrollable symptoms that these children are used to, and training them over and over again to break some of those habits. So sometimes love is hard, I guess is the way I would like to end this segment. But if you trust love, do the things that the doctor, do the things that the therapist are prescribing, and you'll notice the changes. So we'll be back with more on the spectrum.